Good morning. I am Dr. Albert. We have seen each other before. I've carefully reviewed your MRI scan and cerebral angiogram. Based on the imaging, there's a vascular anomaly in your brain that we need to discuss in detail.
係咩異常？我係咪需要擔心？情況嚴唔嚴重？
You've been diagnosed with an arteriovenous malformation, or AVM. It's a rare vascular disorder where arteries are directly connected to veins without the usual network of capillaries in between. This creates a high-pressure system that can be dangerous.
呢種病有幾罕有？咩原因會導致出現呢種情況？
They affect less than 1% of the general population. Most cases are congenital, meaning the malformation develops during fetal development in the womb. The exact cause is not fully understood, but it's not related to lifestyle, injury, or anything you did. It's simply a structural defect that happens as the brain and blood vessels form. In rare cases, AVMs may also be associated with genetic conditions, such as hereditary hemorrhagic telangiectasia.
點解會危險？我嘅腦部係唔係有可能會出血？
The biggest risk with an AVM is rupture, which leads to intracranial hemorrhage. In simple terms, if the malformed vessels burst, it can cause bleeding in the brain, which may result in stroke, brain damage, or in severe cases, death.
點解到而家先發現？我而家都40幾歲，之前點解冇發現？
AVMs can remain asymptomatic for years. In many cases, people live for decades without symptoms. Sometimes, they're only discovered incidentally, like in your case, when people start experiencing headaches, seizures, or neurological changes.
我最近真係成日頭好痛，有時仲會有啲視覺模糊，我以為係偏頭痛，咁我而家開始有病症，係唔係已經太遲呢？我係唔係已經錯過咗最佳治療時機？
No, it's not too late. In fact, the fact that you're experiencing symptoms gives us a clearer clinical picture and allows us to act before a potential rupture. The most dangerous scenario is a sudden hemorrhage without any warning signs. Since we caught it now and you haven't had a rupture, we're still in a good position to plan treatment proactively and safely.
我喺網上睇過嗰啲磁力共振同血管造影圖像，但我完全唔知道自己係睇緊咩，全部都係啲黑白線條。你可唔可以解釋下成個結果係講咩？
According to the angiogram, your AVM measures approximately 2.5 centimeters in diameter and is located in your left temporal lobe, which is the area of the brain responsible for language comprehension and auditory processing.
我有時講嘢會突然諗唔起啲字，呢個係新嘅病症，上次見你係冇嘅。
Even before rupture, AVMs can cause symptoms due to pressure on surrounding brain tissue or what's called a steal phenomenon, where blood is diverted away from nearby healthy brain areas, causing subtle neurological deficits.
我講嘢會唔會越嚟越差？如果我哋做咗治療，語言能力可唔可以完全恢復返正常？我好擔心會唔會係永久性影響。
The good news is that many patients experience improvement once the AVM is treated, especially if the surrounding brain tissue hasn't been permanently damaged. Whether it returns fully to normal depends on the extent of the current disruption and the treatment method we choose. In cases like yours, where symptoms are mild and there's no bleeding yet, we often see excellent recovery with speech returning close to baseline or even fully over time.
有幾危險，會爆裂嘅機率有幾高？
The general risk of spontaneous rupture in an AVM is about 2 to 4% per year. However, if it has already bled before, that risk increases. Other risk factors include deep brain location, associated aneurysms, and high flow shunting.
我諗我應該未試過出血，至少我自己冇咩印象，咁樣風險會唔會低啲？
That's good news. Being unruptured means you have more time to consider treatment options and make informed decisions. But we still have to weigh the risks of rupture against the risks of intervention.
有咩治療選擇？
There are three main options we consider based on the AVM's size, location, and vascular characteristics. One is microsurgical resection, which is open brain surgery to remove the AVM. The second is endovascular embolization, where we block the blood flow through a catheter. And the third is stereotactic radiosurgery, which uses focused radiation to shrink the malformation over time.
我一出世就有呢個問題，而家都40幾年都冇出事，係唔係可以唔理佢？
In some cases, especially when the AVM is small, unruptured, and located in a high-risk area of the brain, we may consider conservative management, meaning we monitor it with regular imaging and manage symptoms like seizures with medication.
我嘅情況算唔算係嗰啲類型？
Based on your scans and the fact that you haven't had any bleeding, you're somewhere in the middle. Your AVM isn't the most dangerous we've seen, but it's also not something we should ignore. Because you're now having symptoms, we're leaning toward recommending treatment, but we'll still take time to go through every option and choose what's safest for you.
你係醫生，我會聽你建議，我信你知道對我最好嘅做法。
I appreciate your trust, and I promise to guide you through every step. But this is your body, your life. My goal is to make sure you fully understand the options and feel confident about the plan we choose together.
做手術前要做咩準備？
Before any intervention, we'd conduct a functional MRI and a WADA test to map out the speech and memory centers. This helps us avoid damaging critical areas during surgery.
你啱啱講過可以封住啲血管，唔使開刀，咁樣係咪簡單啲或者安全啲？
Yes, embolization is a minimally invasive procedure. A catheter is inserted through the femoral artery in your leg and guided up to the brain vessels. We then inject special materials to block off the abnormal blood vessels. However, it may not cure the AVM entirely and is sometimes used as a pre-surgical step.
立體定位放射手術係點進行呢？
Stereotactic radiosurgery is non-invasive. It uses highly focused beams of radiation to cause gradual scarring and closure of the AVM. It's especially useful for small AVMs in deep or risky areas, but the effect can take 2 to 3 years, and rupture is still possible during that period.
以我而家呢個情況，邊一種方法風險最低？
Based on your specific case, I would recommend stereotactic radiosurgery. It's the least invasive option, and because your AVM is moderate in size and not too deep, it responds well to targeted radiation. It may take time to work, but it avoids the risks of open brain surgery. That said, we'll still have our neurosurgical team review everything before we finalize the plan.
做治療期間，我需唔需要食藥？
Yes, we would recommend taking anti-epileptic drugs to control seizures, especially since the AVM remains active during the latency period. Your neurologist would monitor your response and adjust the dosage accordingly.
我有啲擔心嗰啲藥會唔會影響腎功能。我雖然從來冇做過基因測試，但我爸爸嗰邊差唔多每個長輩到咗年紀都要洗腎。有啲人開始洗腎幾年後就因為腎衰竭過咗身，得一個叔叔算係幸運，做咗腎移植，到而家都仲健在。因為咁，我一直都好注意飲食，每日都做運動。希望可以延遲要洗腎嘅風險。如果要食抗癲癇藥，我擔心會唔會對腎有傷害。想聽聽你專業嘅意見。
Some medications can affect kidney function, but fortunately, the anti-epileptic drugs we're considering are not known to be directly toxic to the kidneys in most people. That said, we'll absolutely monitor your kidney function closely with routine blood and urine tests. And if anything changes, we can adjust the medication right away or consult a nephrologist if needed. Your health history matters, and we'll take that into account every step of the way.
呢隻藥有咩副作用？
The most common side effects are fatigue, dizziness, irritability, or mood changes, especially in the first few weeks. Some patients also experience trouble sleeping or mild coordination issues. Serious reactions are rare, but we'll monitor closely. If any side effect affects your quality of life, we can always adjust the dose or switch to another option. Most people tolerate them well.
呢個治療有冇副作用，例如記憶力下降或者性格改變？
All treatment that involves the brain carries some risk of cognitive side effects. Possible effects may include short-term memory problems, fatigue, mood swings, or difficulty concentrating.
我而家係咪要改變生活習慣，例如唔可以揸車，唔可以跑步，唔可以搭飛機，定係呢啲嘢等做完放射手術之後先要注意？
For now, we usually recommend avoiding high-risk activities that could put you in danger if you suddenly had a seizure, like driving or swimming alone. Jogging is generally okay if you feel stable, but avoid anything too strenuous or that risks a fall. As for flying, commercial air travel is safe, but we don't recommend high-altitude hiking or unpressurized cabins. After radiosurgery, These precautions still apply for at least a year while the AVM is healing. We'll keep monitoring your progress and let you know when it's safe to ease up.
多謝你解釋得咁詳細。我雖然覺得有啲資訊過多，但真係好感激你咁耐心同清晰咁同我講解。
It's completely normal to feel overwhelmed. This is a complex diagnosis, and it's okay to take your time to process the information.
真係好多謝你，醫生，你解釋得好清楚，令我安心咗好多。